Yes.
Yes.
You want to hear me?
No.
Okay, thank you.
I don't want to hear you after 4:55. I have to leave then.
You cannot.
Everyone else can listen to you.
Hello, Lynn.
Hello, how are you?
Doing well.
Good. Hi, Chris.
Hi, Lynn.
Oh, yeah.
How you doing? Good.
Good afternoon.
Good afternoon.
Good afternoon.
Chris, could you put yourself on mute?
I will, Joe. You don't want to hear what I say when you talk.
Elizabeth is attending by phone. She just sent me a message, Joe.
Well, her picture is on the screen though, so
Is
maybe
it?
she got on.
Oh, she got on with her phone.
That's pretty
Here's
good.
her picture. I don't see it.
Well, she's on my screen.
Is she?
Yes, she is.
Yes, well, her just her photograph.
I don't even have that.
Go up to view and do gallery. I think
All
you'll
right. All right.
And I
I
have
do, I'm
4:30.
here. I just won't have the camera on.
Yeah, I realized you were there. I just was kind of wondering where, Elizabeth. Yeah, I don't have it on gallery either. I'm not sure why, so. Ah, Angela's there. Hi. Okay. We're only missing what, Jamie? Joe, why don't you get started? Was 4:30 the starting time?
Yes, it is.
Okay, please.
Thank you. Good afternoon and Happy New Year. I usually start with the numbers, and I'm not going to deviate from that in terms of COVID. But nationally, Rhode Island's 7-day average per 100,000 cases is 95.3. That's the third largest in the nation behind Arizona and California. We had dropped down a couple of weeks ago in the 70 range. We're back up to the high range of things. Locally, the numbers are not looking that great. The cases as reported by RIDO indicated that we have 133 new cases, up from 64 the week before. That's a 1 week increase of over 100%, obviously. And that's the highest number of cases we've had since the pandemic began. We had a dip last week. We were climbing up the scale, and then we had the dip. But obviously, this is a significant increase for us. With that said, the interesting thing about the RIDO statistics is I could tell you that, we're in the 6% positivity range, and that is the percent of people who have tested positive out of those tested. And that Middletown, 7%, and Portsmouth is 8%. But in reality, if you look in a vacuum in the last few weeks, our positivity rate compared to the number of tests is quite high. I had someone who sent me some statistics just before this meeting, and I looked at them very closely. And while I don't necessarily agree with them, I think the impact of the statistics are telling. I ran my own, but we have just last week, for example, if you took tests ending the week of January 2nd compared to the number of cases that were reported by RIDO. We're well over 10% in terms of positivity for that given week. And I would suggest to you for those 3 previous weeks as well. On the other hand, so is the rest of the state. The virus is raging pretty well. If you take that same percentage positive that I mentioned before for a place like Central Falls, for example, just by way of comparison, they're at 29%. So of the number of tests they've had during the course of the pandemic versus the number of cases that are positive, their positivity rate in that vacuum of a comparison is quite high. And incidentally, I was on the phone call today with the Rhode Island League of Cities and Towns, which is a phone call comprised of all the mayors and administrators. You know, everyone had the same concern about climbing up that scale of cases. So we're no different than anyone else. I mean, I guess we're trending better in many respects, but that's a relative statement. Hospitalizations are down slightly. They were reported today at 397, down from 405 the day before. That's a good thing. You want those hospitalizations to continue to creep down, but as we know, as we've discovered after every holiday, as it were, beginning at least with more recent Labor Day, we always see a bit of a spike of cases anyways. You know, the good news is, as you're probably aware, I'm going to move off of the numbers unless you have any questions. But the good news is that, or it is good news that rapid testing began today at the Edward King House. And the plan is to run that and anyone, it's a walk-in. And that's going to continue to run every Thursday and Friday until the end of January. It will likely go into February. So if you know anyone that needs to jump on a test real quickly, they can get up there on Thursday and Friday and get that rapid BinaX test, which you get the results in 15 minutes. And in fact, Chris Bean and I were able to refer a couple there today, and hopefully they got there before the site closes at 4 o'clock on those days, and hopefully they got into that site before the closing today. But they can grab a test tomorrow. I was on a phone call today with, as I said, the League of Cities and Towns, and Dr. Scott was on there with her staff talking about the vaccines, or the vaccine. I don't have any dramatic news on the vaccine, other than it's important that we continue to practice what we know, and that's hand washing, mask wearing, social distancing. You know, taking the vaccine is only one of the several things that we can do to protect ourselves and our household. The latter information is obviously one of the public health methods. Dr. Scott emphasized that the vaccine is safe. It's been tested. It's run through all its trials, and that you can be assured that it is safe. No steps were skipped during the vaccine development process. And as you know, there is always with vaccines, we all know this, you know this from the flu shot, at least some of us do, that there's always a little side effect as your immune system builds up. The guiding principles for the distribution, one of them which I wanted to point out to, which I think is the most important, and it makes sense why why it's a phased implementation and who's being vaccinated first, is that while safety is paramount, the whole idea right now is try to minimize morbidity. And what that means is prioritization of vaccine distribution should minimize deaths and hospitalizations as much as possible. And we've talked about that for many, many months. And that is that, you know, minimizing the hospitalizations and our concern over those who have been lost to the pandemic. In terms of data with the vaccine, there have been 27,966 and 966 have received their first dose. 634 people have received their second dose. That's for a total number of doses administered are approximately 28,000. There's a complicated process from federal supply chain to the local level that I'm not going to bore you with, but it's a very complicated process that they're always trying to improve upon in terms of the time that the vaccine leaves the federal government hands to how it gets into the hands of the localities that are administering the vaccines. And of course, the factors that impact that process are the normal factors that you would think that we're all practicing the social distancing requirements to protect the clinical staff that are administering the vaccines. At the healthcare facilities, there's a need to balance vaccinations with staffing needs for patient care, and the immune response. You got to be careful with the immune response. And also, we're in the winter, so you know one of the things that could impact the delivery of the vaccines is the weather. The prioritization is based upon expert guidance, safety, and equity. The state looks at recommendations from the CDC and the FDA, considering the high-risk populations, and keeping our unique population in mind. And it's all reviewed on the state level by experts in terms of prioritization and safety and the like. The vaccine supply, I wanted to point out, is very limited right now. The state is receiving approximately 14,000 doses per week. And as I said, they're taking every measure to provide the vaccine as safely, equitably, and quickly as possible. We all know that additional COVID vaccines are going to get approved, hopefully in the short run. And once that happens, that'll increase the supply that comes around. The two off the top of my head that I would have in mind that I would offer to you is Johnson & Johnson. I think they have a one jab vaccine that's in the third trial. And also Novavax, I think it's the same type of idea. Generally, when you get your first dose, the second dose, you get it about 3 weeks after your first dose. And 2 doses right now with the supply that we have, the Pfizer and the Moderna, 2 doses are necessary. Who can get vaccinated right now? We're in the phase 1 vaccination period, and it's all the people that you would expect: the hospital staffs, EMS, home health care workers, hospice workers, the vaccinators themselves, firefighters, law enforcement, hard hit communities. The state has allocated some of the initial vaccinations to Central Falls because they've been very, very hard hit. They're a hot spot in the state, and they need to get that under control. In the first phase, adults over 75 are getting vaccinated. Dentists, primary care, and everything you've read about, they're all getting hit. And there's no real, all these little phases within phase 1, there's all overlap to those phases. Now, one of the things I wanted to point out to you, which I think is the big question that everyone's mind, is that Dr. Scott indicated that it may take several months to vaccinate everyone in phase 1. Now, why is that important? It's important because if you reflect back on the numbers that I iterated to you at the very beginning of this, the message that we can give as a city government to our own residents is now is not the time to let your guard down. Now is the time to continue to be vigilant and to be careful. That 133 number that I gave to you, again, is the highest number of cases we've had since the beginning of this pandemic, and it was over double from the week before. The logistics of what's going to happen, even within the context of phase 1 and the administration of the vaccine, there's still a lot of planning that's going on. Hospital staff are vaccinated by hospitals. Long-term care residents and staff are getting vaccines administered through CVS and Walgreens at their site. EMS, home health, hospice, firefighters, and law enforcement workers are getting vaccinated through the regional clinics, which are run by municipal partners. Our regional clinic that we do provide staffing to is in Bristol. Other phase 1 individuals will get vaccinated by the community, perhaps, if it's allocated to us, if the med pods are open. or on-site vaccine clinics or other sites that are available, like pharmacies. We were told today that the federal government is pushing out the idea of pharmacies being the vaccination sites, ultimately, when we get into the larger processes. But that does not rule out that the pharmacies will be able to handle those vaccinations, and hence the need to open up our MedPod sites, which we are well equipped and still investigating and still developing. And in fact, I spoke with Chief Dugan yesterday, and we'll be getting together in short order to try to zero down on locations and preparations and all those things that go along with preparing for operations in the event we become a MedPod site. What else can I tell you? That's about all I have on vaccines. I think one of the things I want to tell you, though, is the governor's press conference was postponed till it's tomorrow. And I think you'll hear all this information again if you attend her press conference, and probably more information than what I have. I'm just pushing out to you what I've received today, based upon the phone call that we had with the Rhode Island Leaguers and Cities and Towns had arranged with Dr. Scott and her staff. Again, one other thing I think I mentioned, but equity is at the heart of the vaccine distribution determinations. The high density communities are heavily impacted, and they're really trying to zero in on those as part of the phase 1 process. And right now it's really Central Falls centric, if you will, but it's going to branch out a little bit more as time goes on. But that's my report today on the three things: numbers, testing, and vaccinations. And I'm open to any questions that you may have. Don't everyone jump.
Hey, Amy. I had a question about getting, or when some of the local places, nursing homes, Donovan Manor, when they would know where they were on the list for vaccines, specifically for Donovan. I've been talking to some folks over there, and they're nervous, and they want to know where they are in the list, just because they're somewhat treated as a nursing home, but obviously are not at the same level as a nursing home. But those folks are, they've been shut down since March or April.
I know that Rhonda Mitchell is putting some things in motion for them, and has reached out to RIDO to try to pin that down a little bit more. And that and I'm getting this secondhand from Chief Dugan. Rhonda did call me, I think yesterday, about that, and I owe a phone call back. She's reached out to some of the pharmacies that would that administer the vaccines, and I think they're working something out. I don't know. I didn't get that from her. I don't have that as a fact, but that sounds certainly logical to me. Again, Jamie, the issue is going to be the other nursing homes, the private nursing homes. They are getting administered vaccines. The issue becomes an issue, and Chris and I just had this conversation less than a half hour ago. It's an issue of supply chain and how quickly the vaccines are offered.
Yeah.
So it's the supply chain is this. Everyone knows this nationally. Every state has their own little issue that's going on with the vaccinations, but the supply chain's an issue. I mean, I would have loved to give you better information about, other than tell you that and I'm quoting this from a PowerPoint that I just received, that it may take several months to vaccinate everyone in phase 1. Exact timing depends upon demand, doses made available to Rhode Island, and other factors. I don't know what those other factors are, other than some of the ones that I iterated before about just getting the stuff here. But so I do think that once these other companies come online, that the availability will increase quite a bit, and and things will happen more rapidly than they are now. And indeed, I think if you follow all the media on this, that bears it out.
Yeah.
From the experts, the
Lynn?
national experts.
Hi, yeah, I just wanted to mention that at a Newport Partnership for Families meeting, I had the Community Baptist Church Annex at 40 Marcus Wheatland Boulevard. They're doing free rapid testing also on Saturdays from 11 to 3. So that's in addition to the Thursday and Friday at the Edward King House. And it says results within 15 minutes, no appointments necessary. If you have an insurance card, bring it, but it's not necessary.
Well, tell me that time again, because that's news to me. And other than being annoyed that I don't know about it, that's great news.
11 to 3 on Saturdays at the Community Baptist Church Annex at 40 Dr. Marcus Wheatland Boulevard.
Okay, great.
Okay,
That's-
Charlie?
that's-
Oh, I'm sorry.
Yeah, so with the rapid testing sites, Edward King or now the Community Baptist Annex, are they equipped to give some sort of certification of a negative or positive test result? So if somebody needed something to go out of town or what have you, are they able to get some sort of paperwork done for that?
Charlie, I don't know that for a fact. I assume because I don't think it's just a phone call that they make to tell you that you're positive or not. I think there's got to be something that they process in terms of paperwork. But that's a good question. I'll find out.
Well, the couple places I've seen that do this, the Binax test is you take the test, you wait there 15 minutes, and then they tell you the result. Then they keep it and throw that away because it's hazardous material at that point. So
Okay. Well, I'll raise that.
You're negative. Carry on.
I'll raise that I'll find out. And then if the answer is no, then I'm going to contact RIDO and say, can they tweak their system a little bit so that there's at least some type of certification that can be provided. I don't know, I don't know why they couldn't. I mean, just like when I took my PCR test up in Warwick at one of the clinics up there, I had online, I was able to get the, I'm not going to call it a certification, but certainly what the results were.
Yeah, I know it said
Which weren't good.
The ones I went to, it's up to whoever the people are that are doing the test.
Okay.
They keep track of everyone's information results. They have to then go physically to the RIDO website, put all that information in, and then that information gets posted. It takes a while.
Marcus, the Edward King House was arranged through the National Guard. So it at least has that direct synergy back to the state as opposed to just acquiring the test kits and the like. But I'll check on that. It's a good point.
Joe, at 14,000 doses a week, we can't even get the state of Rhode Island done in a year. You're talking about what?
No, go ahead, please. I'm sorry, I didn't mean to interrupt you.
You're talking about 2 doses, if it's, I guess, the Moderna, and other companies coming in. Do you have any idea of whether they're going to ramp those numbers up to get more Rhode Islanders covered?
Well, we're going to have to. We're going to have to ramp it up. I mean, they are ramping it up nationally. This is the beginning of the program, and I think the promise is that things are going to get ramped up. And right now it is what it is. But I mean, even what did they say nationally, that they had generally promised there'd be 20 million doses of vaccine. There's but it's quite a 14 million produced. And the minute these things were approved, then I'm sure they went to manufacturing more. And of course, as you know, the president-elect has promised something to the effect of 100 million vaccines in 100 days. So it's all about the supply chain. It's all about the manufacturing of these vaccines. And the more you have, the more availability you have of the brands. not just Pfizer and Moderna, but the Johnson & Johnson and the Novavax, and a few others. I have a list of them somewhere. Then I think we'll be well along at some time. It's just within the context of phase 1. They're not telling us what's going to happen in phase 2. No one's telling us yet because they're still logistically figuring out phase 1, the administration of phase 1, what's going to happen in phase 2 and what's going to be available. It's an issue of supply.
Okay, thank you. Are there any other questions? Any other information you want to share with us, Joe?
No, I'm good and glad to be back.
All right.
No, not yet.
Okay, thank you.
Thank you. Nice to see you all.
That concludes our meeting.
You.